much detail. If anyone is interested, just email me or just send me questions. I can go into detail then. But from the expression of interest to the awarding of the certificate, International Healing Forest, we have some steps in between. One important is the concept of use, which is provided by the applicant. And there are two expertises within this process which need to be made. One is a forestry expertise and one is a medical expertise. And in the end, on the right-hand side, this is the international certificate which is awarded. In this slide, you see some certified healing forests. The first one was set up in Austria in 2021. And last year we did set up 2 healing forests within Germany, quite in the middle of Germany, you can say, one in Lahnstein and one in Bad Nauheim. And there are several current certification projects running. Here you see a little selection. Yesterday we heard from Miguel about the setup of a healing forest in Mata do Busaco, Portugal. We have another one in Austria, and we have different countries where healing forests are set up: Lithuania, Slovenia, Finland, Italy, and some other ones as well. Now, what are the potentials for health? We all know about these. I just go quickly through them. The health promoting effect of the forest has received increasing attention, which is great that it is happening in an international scientific community. The health promoting climate of the forest we know all about. We have clean, low pollutant air and high humidity relief, which relieve the symptoms of respiratory diseases. We have the sensory stimuli such as birdsong or the smell of the various flora, which have a relaxing effect. We have subdued light and the predominance of green tones, which promote stress reduction and raise the mood. And the forest provides incentives for movement, which promote motor skills. In addition, spending time in the forest has a positive effect also on the mental health, increases the sense of well-being, reduces stress, lowers blood pressure and pulse, and positively influences the immune system. So I think we all agree that forest is a unique therapeutically effective cocktail for the treatment of different diseases and indications. So which medical indications are suitable for treatment in the healing forests? Here you see a little list. Cardiovascular diseases are integrated, respiratory diseases, orthopedic diseases, oncological diseases, psychosomatic diseases, and also neurological diseases are treated in the healing forests. And when I talk about treatment, we need the person who treat. And here I would like to citate Alex, because he said a really good thing once at YouTube. When we talk about forest therapy, we are not just talking about quality of life, but clinical intervention, rehabilitation and interventions where specific programs are developed, taking into account the participants and their barriers. So we need to set up specific programs and keep in mind the clinical intervention. So in different countries all over the world, forest therapy and forest prevention is set up. It's named a little bit differently. So we have the persons who are allowed by their profession to treat in the forest, and we have people who from all professions who do forest prevention. So I call it therapy and prevention. I know, or you all know, that we have different names for these two different parts. So for forest therapy, the requirement is a regulated health profession. The scope is clinic, physical rehab, and the treatment of medical indications. And also in our state, we have a program set up, and the graduation is called Certified Forest Therapist. On the other hand, on the right-hand side, if you go into forest prevention, the requirement is not a specific health profession, but everyone from all professions can start this program, especially green occupations educators or people from the tourist industry. The scope is not the treatment of medical indications, but prevention, health promotion, stress management, and relaxation. And the graduation is a certified companion for forest prevention, or whatever you call it in different countries. To go a bit into detail, if we talk about forest therapy, the course participants can develop and implement therapeutic programs for patients in and with the forest, and they get the medical, health, psychological, forestry, and didactic knowledge to integrate the healing effect of the forest on physical and mental health into therapy concepts and rehabilitation. When we talk about forest prevention, the target is to develop and conduct forest-based programs such as mindfulness or prevention trainings, and get the medical, health, psychology, forestry, and didactic knowledge to offer events in the field of forest and health. So on the one hand, we have these two different treatment and training strategies which we can use, or now I also say use the forest, use the healing forest for. On the other hand, we also have this non-medical part. So healing forests have two tasks actually. They are used by patients, but they are also used by tourists and residents. So when we talk about the medical aspect of a healing forest, in the upper part here, they are used with medical supervision, and we talk about participation at special medical events in closed groups. But for sure, the healing forest is also open to everyone. And we have this tourist aspect you see down here. We have individual inspections of the forest. You can call the people health tourists, day tourists, or for sure the residents will use the forest. Also, they can participate at events, for example, forest tours or hikes, lectures or concerts. So the healing forest, the special aspect is to treat, the treatment in the forest, but for sure the healing forest can be used for many, many different indications and ideas. What are the recent developments and trends? Originality, the attractivity, and the short distances are target parameters in future tourism. Focus topics of health tourism are the terms of wellness, relaxation, awareness, and mindfulness. Health tourism develops from the supply to the demand market. The more we supply, the more tourists we get. Our county is based right at the Baltic Sea, so tourism here is a very big issue. We have an increased health awareness. People would like to actively contribute to the individual keeping of their health. We have an increase in demand due to higher life expectancy. And we have the term work-life balance, and the idea stimulates the market demand. So all these aspects are important when we talk about healing forests. What are the benefits for everyone? For tourists, is the interesting offer in health tourism of healing forests. For the residents, local leisure activities are provided, and we have the increased residential value. Community, we have a signpost and image promotion. For the Tourism and Gastronomic Association, they address different target groups. For companies, for example, we have an increase in the attractivity of the region when a healing forest is established in the community. And for the health institutions, customized infrastructures and the possibilities of use of the forest are very important aspects. Now, I would like to introduce two healing forests and the potentials of use. I was thinking which ones I will present, so I decided for the first healing forest established worldwide. The first one established in Mecklenburg-Vorpommern. It's the healing forest Heringsdorf. It's located close to the Baltic Sea. You can see this little blue bit here, and here you see a map of the forest. I show it again later. And the second healing forest is the forest in Lahnstein. It's in the middle of Germany, in the county of Rhineland-Palatinate. Now, Heringsdorf, sorry for that. Heringsdorf, the first healing forest setup. The healing influences of the forest health studio is supported with integrated healing forest areas and trails. On the left-hand side, you see the map of the forest, and it's very well signed. A signpost network of paths with different levels of difficulty serves to motivate the movement. At various forest locations, you are invited to take part in special physical or meditative exercises that promote holistic well-being. And the healing forest can be used by patients of the rehabilitation clinics nearby, and also, like I said, by the general public to promote their own health and personal well-being. So, for example, on the bottom here, you see the trail network with the different levels of difficulty, so people can decide which way to go if they would like to exercise a little bit, do some physical training, or if they would like to choose some areas where they can do some mental training. Important are, as I mentioned, criteria is the signposting and the setup of stations where people can actively train. In Heringsdorf, there are actually 10 stations set up. We have one motorically active sitting side, we have a balance beam, we have a balance board on springs, we have the station called 100 Steps, we have the tree trunk hopping course, we have a sensory perception path, we have a boulder obstacle course, we have a climbing circuit, and we have the fourfold high bar and a meditative movement therapy. On the right-hand side, you see some examples of these stations. And this is how it looks like in real. On the picture, you see the station in the background, and you see the signage where the station is explained, the level of difficulty is explained, the health outcome is explained. So people can go into the forest individually, but you can also go there in groups and train with one another. Health maintenance, prevention, and rehabilitations are of importance. So the information boards show how to use the exercise equipment properly with the different variants that are possible, easy variants, a bit more difficult variations, as well as the training effects of the station. And the exercises serve to build muscles, help to prevent falls, to train coordination, balance, and concentration, and to enhance perception. Some of you will actually visit this forest end of next month. We have from the Horizon European Project consortium meeting end of May here, and we integrated a visit actually of this forest. So if you see these pictures, you know what you will expect end of next month. And to finish with Heringsdorf, I'd like to share this really lovely picture with you of the motor skills trail, where different stations are integrated to one, and you can actually train different parts of the body in this motor skills trail. The second forest is the healing forest in Lahnstein. This city followed the example of our county, and they actually also changed their Forest Act. By changing this, they were able, like Mecklenburg-Vorpommern, to set up a healing forest, which they did. The healing forest was established in 21. And when they heard about our International Certification Office, they said we would like to have this international quality and standard of a healing forest, and they asked for the international certification. And this was awarded, you see the awarding ceremony in the bottom picture. In September last year, we awarded the international certificate. And this forest is actually my favorite one because you really feel and see what can be created if people work together and people work as a team and people from different professionalities work together, and all the professions come together and set up something. And here we have people from the medical profession, from the community side, from the forestry on the left-hand side, this person. And they said, meanwhile, they are friends. They go there on the weekend and they don't stop working on the healing forest. They still have ideas. They still set up this forest. It's still a very creative forest. So I'd like to show you some pictures and introduce this forest to you as well. Here you see the map, and they didn't set up like Heringsdorf, different stations. What they did, they tried to integrate all indications of medicine into the forest, and they did set up different trails and clusters. So for example, here you have the psychotherapy trail. You have a lung cluster where you treat asthmatic and lung sick people. We have an orthopedic geriatric cluster. We have a cardiovascular trail, and we have a relaxation mindful trail. This relaxation mindful trail, for example, is this purple trail here. The psychotherapy trail is a mindfulness trail, which is running 7 kilometers all over the forest. You can see it here. And the clusters are set up as different areas of the forest where you can train specific indications. For example, here, the cardiovascular trail, you have a different profile of slightly inclining to gradients up to 350 meters. So if you are not very well trained, you can go this little circle here. If you are a bit better trained, you go the larger circle. And this is what I mean. They really did think about how the forest can help people to get healthy. So the surface range from flat areas, slightly increasing, like I said, up to 350 meters. We have quiet and noise forest areas that allow relaxation or activity. We have open spaces on the edge of the forest, actually around here, with a wide view over the country. And we have a mild, gentle climate with varying bioclimatic intensities. This is because of the area where the healing forest is set up. Oops. There are always events taking place in the forest. There are currently guided tours on the subject of forests. There is a yoga in the forest, experiencing nature and mindfulness for people with dementia and their relatives. It's also a course. Partners from the medical sectors are, and this is a great advantage of this forest, that actually a number of medical centers are involved. We have an orthopedic and psychological center. We have the Armed Forces Central Hospital nearby, and we have different other clinics nearby. They all use the forest. They all contribute for the creation of this forest. There is a timetable where you can actually sign in and number your course you like to perform. The covered therapy clusters are clusters of psychiatry, psychosomatics, orthopedics, pulmonology, pain therapy, oncology, cardiovascular diseases, ear, nose, and throat diseases, immunology, obesity, pediatrics, and nutritional medicine. So a really very all-in-one concept. So I'd like to show you some pictures of the clusters. This is the orthopedic cluster. The person in this third picture here, he's a medical doctor. He was running the orthopedic clinics for 25 years. Now he is retired. And like I said, he's one of these very enthusiastic people trying to set up good devices where you can perform especially fall prevention in the orthopedic clusters. So they did set up this device here with a different surface profile. They did set up this little trampoline, which you can use individually, but it's also created for actually wheelchair using. So you can go on this trampoline with the wheelchair and you get this feeling in a wheelchair that you are moving, which is a very, very rare feeling for somebody sitting in a wheelchair. You have the balance part here. So he said it's for him, or the concept of the forest integrates that groups are training there. So it's always all the devices are set up for not just one person, but more people. And this is the balance station. And you also have the muscle strengthening in this cluster. Let's go to the lung cluster. In the lung cluster, we have the King Arthur's Round Table. And this is also a very nice story again from Dr. Henning. You see him again on the left-hand side. He created and developed and did build and set up King Arthur's Round Table. He said he's a big fan of the medieval age, and his idea is you stand in the middle of the table and you train the torso rotations. So when you have a lung sickness, it's very important that you open your torso and that you bend to the left and to the right. And you have a little stick, which you see here, and you are standing in the middle, and then you are bending with the hand. You open your torso and you bend to the left and right and try to position the stick in these little holes here. And when you come back, you can actually see if you can open the chest more and more with each exercise session. In the middle, you see the Mikado game, which is a big Mikado game. So the Mikado sticks are actually tree parts, branches, and everybody can use it. The branches are in this little box here, and you can take them out and you can play. And we also have the 5 in a row game on the right-hand side, where you can train bending and stretching and hand-eye coordination. So if you have a lung sickness, moving is very important. And to stretch the lung and to expand the lung is important. So when this 5 in a row is about 2 meters high, so you have to, if you would like to position your whatever you take, your stone or your fruit from the forest or whatever, you really have to stretch out to reach the position, or you have to bend down to reach the position. So this is the exercise for the lung patients. We also have the relaxation trail. I'd like to show you some really nice pictures. And here you can see one of the concepts of the forest is to go there with groups as well. So if you do a course or a group training, you always have at least 10 chairs or whatever you do to integrate 10 people. So I really, really like this area on the left-hand side, where you have the circle and you can lie down and you can have a look at the sky, and you see the sun and the leaves and the different lights. So it's really a very, very nice place. Then you have one part where you, like I said, you can see the country, and this is also very relaxing. And you have the mindfulness path you can see here on the right, which is also very lovely when the sun shines through the trees. And also, last but not least, one criteria of a healing forest is that you have a laboratory. The forest is visited by people of different age groups and patients who are most of them are very thankful to have the possibility to go to use a loo. It's a composting toilet. They did set up at the parking space 2 of them. On the left-hand side, also one with this wheelchair accessible. And also a very nice idea, we heard it yesterday from Taru as well. They integrated in their health forest the sculpture park, and the Lahnstein people also did it in a way that we have a power saw art on the tree trunks along the trails in the healing forest. So if you just strolling around, you now and then see these little sculptures made from the forestry people with their power saw. So to conclude, the creation of healing forests offers an additional potential for health and well-being, offers an additional potential for health tourism as well. So like I said, we have these two concepts, the tourism concept and the health promoting concept. It helps to raise attractiveness of the region, which is important for tourism as well. Also offers the potential for forest use in the low season, contributes to the protection of natural resources and thus to combat climate change, and offers qualified standards and criteria to promote the implementation of controlled studies. So I hope I could introduce the forest or the concept of a healing forest to you. And if you have any questions or, like I said, just email me or maybe we can discuss a little bit. So thank you very much for your attention.